There's a lot of noise about LMPs. There's also quite a bit of noise about in vivo CAR T. I would say, if I had to sum it up all, um, we need to make cell and gene therapies more accessible and available to much larger groups of the population, ideally across multifactorial setting. And and to do so, we need to come up with, I guess, better science, better biology, and better CMC, better manufacturing, and better regulatory framework and support. So all of these pieces need to come together to ensure accessibility of cell and gene therapies to, ideally, to first-line care.
I would say our own for sure in the run because we are trying to really shift the needle into prevalent conditions, moving cell and gene therapy from rare diseases and monogenic indications to prevalent neurodegeneration like Parkinson's or Alzheimer's.
In vivo CAR T is definitely the hot topic at the moment. You've seen multiple acquisitions by big pharma, which suggests that they also see that is a viable approach, and loads of really interesting clinical data that's appearing, which seems to support it. It's yet to be seen whether that will translate into solid cancer space. But if it does, it'll be a massive game changer because it will massively increase the proportion of patients who are eligible to be treated and massively drive down costs of therapy as well.
There's like a lot of fields and a lot of indications that are very interesting. Particularly, we found that oncology or personalized cancer vaccines are some of the one field that is very interesting and that we think presents some challenges where the industry needs to be very proactive and able to serve those needs in a very quick and efficient manner. So that would be a good example. But there's others like very unmet needs, like for Parkinson's or other conditions that clearly have very limited resources now.
I think CNS applications of gene therapies could be a huge game changer, especially when you think about how as we're getting an aging population and dementia and other sort of neurological diseases are going to become more prevalent. Those sorts of breakthroughs and applications of gene therapy technology and cell therapy technology will really pave the way for improved quality of life as we all get older.